Big Oos. Yeah, they have their food festival, I think, in July.
Yeah. Well, that's a part of the Samoan week that I got recruited
The voluntold. I heard the meeting was it this past Sunday? Or was it last week? It's like the last meeting. The last week. Yeah, that is it.
I love it, but it's very Tacoma-centric. Me, I'm from South Seattle. But they do a great job. Appreciation. Do without the church. Thank you.
I just like to make you mine.
The universe. Hashtag the universe.
Give it up, baby, give it up. Baby, give it up, baby, give it up.
Oh, no. It's supposed to play some music, so I don't know if we can hear it.
Everybody sees you.
Shut up.
Everybody looks so scared. I just like to make you my all, my all. Na, 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 na. Baby, give it up, baby, give it up. Na, 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 na. Baby, give it up, baby, give it up.
The other thing is it's live.
Give it up.
Yes, live. Going to the fade right now.
But do we have the live link? Did he put it in the chat?
You want me to text it to you?
Yeah, sure. All right, I'm on. I'm good to go. Hey everyone, thank you so much for joining us for our 8-part inner wellness series for us and our therapists. This is actually our third time putting this on, so we're excited to be here, and thanks for spending your evening with us. Before we get going, I just want to give a shout out to our sponsors. This event is actually sponsored by Shoreline Community College's WAVES program. Worthy of achievement, validation, empowerment, and success for Asian Americans, Native Hawaiians, and Pacific Islanders. On the Facebook live chat, we'll actually throw the link on there. So if you're interested to see what amazing things are going on at Shoreline Community College. We also are hosted this year by Big UCE Radio. The Big UCE Foundation is a local nonprofit organization committed to building vibrant communities through youth development, art and culture, music and entertainment, radio, sports, and business. So shout out to Big UCE for allowing us to stream on their platforms. And this is also kind of our kickoff event to Oceania Health Summit 2024. It was actually co-led and sponsored by some youth and young professionals. Our thematic goal for the year is global impact and island roots. So through Tacoma Pierce County Public Health, who's one of our sponsors, and the Office of Equity and Community Partnerships at King County Public Health, we're really just kicking off kind of that summit now. really addressing one of the key issues that were brought up by the young professionals and youth was mental health and kind of how do we deal with it? How do we unpack it as Pacific Islanders, right? But I won't steal Sala and Scarlett's thunder because they'll go into more details. With that, I would like to turn it over to our amazing health therapist, Sala and Scarlett.
Oh, Seely, man, it's good to be back in this space with you. Una, great to be back with you as well. So good evening, everybody. Thank you so much for being in this space with us, with Sala and I. For those who are here live on the Zoom, if you have any questions, have anything you want to share, you can either unmute yourself or put your question in the chat. Same thing with those who are on Facebook Live. Thank you for joining us on Facebook Live as well. Put your questions and comments in there as well. So that being said, my name is Scarlett Ikaroma. I'm a licensed marriage and family therapist and boundaries coach. I've been in this field for over a decade, not without only seeing clients through my private practice, Elevate Healing. I also get to do this great community conversation work with my colleague, Sala. And it's such a blast to be doing this. So tonight's conversation, we're going to talk about what is therapy. Anything you think about with therapy, believe me, we got you covered. Okay. So that being said, I'm going to swing it on over to my sis, Sala, so she can introduce herself and so she can take us on this What is Therapy journey. Go ahead, Sala.
Thank you, Scarlett. Just want to reiterate what Sue said earlier. Just thank you to all of our sponsors, because without your contributions, like none of our community members would have access to this information, unless they are actually in therapy, which can be very, very expensive, and again presents a huge barrier for our community. So being able to partner with all of our community partners, for them to be able to sponsor these conversations that Scarlett and I get to facilitate, we are truly, truly thankful. So just wanted to echo that as well. But we are excited about tonight's conversation. Now, before I get going and forget to introduce myself, my name is Sala Afalava, and I am also a licensed mental health therapist here in Washington State. I'm also working out of my private practice called New Hope Counseling. And then on top of that, I'm also a doctorate student. I attend Northwest University in Kirkland. And then, of course, I'm a mom of 2 boys, and I'm a wife of 17 years. I believe, I hope I got that one right. And then also a dog mom of 2. So lots of great stuff there to share later on. But more importantly than ever, we are super excited to have this conversation tonight about what is psychotherapy. A little bit of background information on how Scarlett and I came about to talk about this 8-part series coming through this the next couple of weeks is these are the different themes that were coming up for our community in Scarlett and I's own experience in therapy. So these are all of the different themes or issues that we were seeing people from our communities coming into therapy for, or even just asking a whole bunch of questions about therapy, because it's not really something that is very common avenue of help for our communities. So a lot of people in our AA and HPI communities had a lot of questions. So tonight's conversation on what is psychotherapy truly, truly breaks down like what it is. And now if you've been in therapy before, then some of this information might be super familiar to you. And if you've never been in therapy before and always wondered what that might look like and how do you even begin to get started, this is a great conversation for you to where you can just pop in at any time and just ask Scarlett and I any questions you have, or even just sharing your experience. We've been running this conversation for quite some time now, and we have different people share their experiences all the time. So it may be on the same topic, but it's different conversation because different people are chiming in every single time. So again, tonight's conversation is on what is psychotherapy, and I am going to share my screen, and then I'm going to take us through what we will be discussing tonight.
Awesome. And so while Sala sets us up, so again, if you have questions, whether you're on Facebook Live or in the Zoom, please don't hesitate to put your questions in there. The only thing that we ask is that you keep the questions relevant to tonight's topic. And if you want to share as well, please go ahead and do that as well, whether you are in Zoom and you can unmute yourself, or for the Facebook Live, you can put it in the chat there as well, because we will be monitoring both. So, Sala, you ready?
Yep.
Awesome.
All right, so just a little bit of information. So my internet's been kind of wonky all day, so if it is a little bit delayed, please let me know, or let Scarlett know. Just kind of wanted to give that forewarning in case there's some feedback or anything on your end. But all right, let's get going. So tonight's conversation again is on what is psychotherapy, and so I know that whenever, at least in my own experience too, whenever we hear the word, psycho, or psychotherapy, kind of break down a little bit, and also just to kind of hopefully shed some light and some understanding is psychotherapy stands for psychological and therapeutic services. Okay, so psychological is pertaining to your mind, your mental health, and things like that. So and therapy are the different therapeutic approaches or interventions that a therapist or someone that is trained in this field, usually a licensed therapist or social work, is sort of like an approach that they use to be able to help people that are kind of going through things in their minds. So I know there's so much stigma associated just with the word psycho alone, which is why you hear people kind of just saying the word therapy, either just therapy, or sometimes it's used exchangeably with the word counseling. So it all means the same thing. Psychotherapy and counseling, sometimes people use it interchangeably, but it's usually they drop off the word psycho because of the stigma associated with it. But hopefully that we're able to kind of shed some more light on that. But all it stands for, it's psychological therapeutic services. Okay, so just wanted to share that a little bit before we move a little bit forward, because I know somebody will hear it and just kind of be turned off and they're like, ugh, this is bringing back some memories. But all right, let's get going. All right, so we are starting off with just being able to share with you a little clip that we usually share in this conversation. But before we even share this clip, just kind of want to put it out there for engagement. And let's just see if we get some engagement tonight. Let me know. I want to put it out there for everyone that's kind of tuning in on Facebook or whichever mode of media you're tuning in from. When you hear the word therapy, what comes up for you? Like, what's the first thing that comes to your mind? When you hear the words therapy, what is the first thing that maybe comes to your mind? So just going to throw that out there and see if anybody want to share any response. And let me know, Celia, if anybody just kind of types in any response.
So in the chat, someone said weakness.
Oof.
Oof.
Yes. Mm-hmm.
Counseling. Someone else said counseling.
Mm-hmm.
Mm-hmm.
Weakness, counseling, yes. Anything else?
I think it's like what you said earlier, like crazy.
Mm-hmm.
Because I'll say for me, before I became a therapist, a lot of my ideas of what therapy, mental health was whatever was shown in movies, which was not the greatest representation at all.
No,
Yeah,
not at all. Yeah, not at all. I think like in addition to all of that too is like therapy just wasn't, I think like for me growing up and in my own experience, I think it felt like it just wasn't for me. It just felt like it's something that's like for other people. It just didn't feel like it was something that was particularly for me, a Samoan person, a Pacific Islander person. Like, it just wasn't something that we did. Like, we did not go to therapy. It wasn't a thing, so it didn't seem like it's an avenue of help that I could get into.
Yeah. Somebody in the chat also said help.
Thank you. Thank you for sharing that. Yes. So if there's no other response, then we're going to go ahead and share this short clip. And it's always interesting, and I really like this clip because it's our own people. And it's almost like this really, really raw response from our community elders and members of the first thing that comes to their mind whenever they hear the words therapy. So let's go ahead and take a listen.
I think you can talk about stress.
Okay.
Anxiety, you can talk about it, but mental, no.
They don't call that mental.
What do they say? Crazy?
Crazy.
They label you.
So if you talk about it, then you'll be labeled.
You'll be labeled. There's a mental person in your family, and no one is supposed to.
When I say the word mental health, what is the first word that comes to your head?
Embarrassment.
Okay. Embarrassment.
To the family.
To the family. If someone has a mental health issue, what's the first word?
I don't like saying it, but
no, do
they're
it.
retard.
Okay.
But
no, we just have to be honest here. Handicap, retard. Yes. That's fine.
Seclusion.
Okay.
No, go with what you said.
Which one?
Retard.
Okay.
I don't know how to.
It's really hard with the Pacific Islander community because we don't have words to describe what's depressing, what
the
bipolar
American.
is.
Okay.
They're all crazy.
That's the thing. When we came from Tonga, we only learn about stress and depression here.
Here in America.
Yeah.
And when the diabetes, if your sugar diabetes is low and you are sick, and in the island, they think you are crazy.
Okay, so we'll spend a little bit of time just kind of like talking about this video for a little bit. I'm just kind of curious, like, what is something that stood out to you from this video? If anybody want to share, I want to give space for that.
It's not surprising, right? Growing up as an islander, I mean, it's kind of the stigmas you're used to. So,
yeah, for sure. What else?
Tony, did you want to share? I saw you unmuted. Yes. Somebody said it just seems negative when you hear about therapy in the chat. Ooh, that's
yes. Yeah.
Yeah, I think just to add on to that comment, and that's why Sala and I found it important to do these classes, because it's a different conversation when you see people, your own people who are people of color, Pacific Island women, be more specific, Samoan women, who can have these conversations because we know our communities.
Yeah. I think like an interesting thing from this video too that so we've also introduced this idea of therapy to the elders in our community. Scarlett and I did a conversation with them, and one thing I'm remembering from that conversation with our elders, and then with what was said in this video, is how sometimes they can confuse mental health, mental illness with a medical condition. You remember that, Scarlett? Like just from our elders?
Yeah, and it was, there was, because a lot of them, a couple of them have brought up different medical condition. We had to say, no, that's medical. We're talking about mental health, feelings, thoughts, and it's just undoing a lot of what they thought mental health therapy was. And I think that's the important part about having these conversations, because we help and empower and give our communities that information, especially our elders, because no one taught them about it. No one, again, because of that video just shows just the ideas that they had about therapy.
Yeah, so it just either, I think maybe depending on their experience, really kind of shapes their perception of what therapy is. And like Scarlett said, this is why we really wanted to kind of clear the air and just say, okay, community, we want to, reintroduce therapy. Yes, this Western concept, because we know that our community members are suffering, and most of the time they're suffering in silence and they're not reaching out. Matter of fact, research shows that AA NHPI communities have the highest rate of not utilizing mental health resources. So that means we're not utilizing these things, even though we need it, even though we need the help, but we tend not to. And I think a lot of the time, like, that has a lot to do with stigma, with so much stigma, not only our cultural stigma surrounding mental health, because, hey, let's just keep it in the family, or from our experiences and how we perceive what therapy is. So again, this is going to be our agenda for tonight. We really want to just define for you what psychotherapy is. And hopefully by the end of this conversation, you won't feel like therapy is something that's so daunting. Like, you won't feel like therapy is something that is not for you. Our goal is to hopefully empower you by the end of this conversation to be able to seek out that help, that mental health resources, if and when you need it, and not suffer in silence. Okay, so our agenda, we always like to lay it out. Like, this is our plan for tonight. We're going to define therapy. We're going to talk about some benefits of therapy. We're going to talk about something that's really, really important in therapy, which is this trust that we call the therapeutic alliance between a therapist and a client. We're going to talk about the different types of therapy and just introduce a little bit of the cultural aspect of it and how I, as a person of color, would tie in therapy or use that with in connection to my culture. And then Scarlett and I are going to share with you how, if you are coming in this conversation, you're like, I don't even know where to start. There's just so much, places to go to. How do I even find a therapist? We will break it down for you. We will even make it to where we can give you questions to ask a therapist. So if you didn't know that you can ask a therapist, but yes, you can in that first interview, what to look for in a therapist, and then just kind of understanding your rights as a client. That is our game plan for tonight. Okay, so moving along. Again, our purpose, we just want to empower you. We want to be able to empower you in this conversation, and for our communities, our AA NHPI communities, to be able to understand the importance of mental health and how to seek those services. Like I said, research shows again that our communities underutilize mental health services. We do not use it, pretty much is what the research is saying. And that's totally understandable. Like, we know where it's coming from. But of course, that's not okay, or that's not good for someone that actually needs the service. Okay. All right, so then what is psychotherapy? So psychotherapy is this interaction between a licensed, trained professional and a client. Okay, that's what it is. It's an interaction or treatment between a licensed and trained professional and a client. This is the difference between you just kind of venting to your best friend and going to therapy. Okay, and so, like, I always enjoy using this picture, this visual, as an example. Like, if you look at this picture, this couple is coming in. They have this just ball of yarn that's all knotted up. They have an issue going on in their relationship. Maybe they have an issue going on in their marriage. I don't know what it is. But they're going into therapy because they can't seem to unravel what they're going through by themselves. So they go in and they speak to this person that's a licensed, trained professional. And what this person is trained to do, what this therapist is trained to do, is they are trained in so many different interventions, so many different techniques, so many different approaches, so many different modalities to be able to unravel whatever it is that you are coming into therapy for. They're able to just kind of take that string, from whatever it is you're coming in with, that's all knotted up. And this therapist is able to just kind of unravel that a little bit and hopefully help the both of you to be able to make sense of it and then give it back to you. Okay, so I'm going to pause there for a bit because I know that's already like a lot of information. But if anything you can take away from this slide is pretty much what psychotherapy is. So this word that's just seems like, like, oh my gosh, the word psycho is in there, so it's already like kind of crazy. Like, no, it's psychological therapeutic services. Okay, psychological having to do with the mental, having to do with how you think, with how you feel about things. And then therapy is like the different techniques, the different interventions, the different modalities that this therapist is trained in order to be able to help you navigate through whatever it is that you're going through. So again, it is that interaction or treatment between a licensed and trained professional and a client. And now the client can be an individual person, it can be a family, a couple, or a group, and we'll go more into that later on. Any questions, comments, or Scarlett, do you want to add anything?
Yeah, just for those who are in the Zoom. So there's the event summary. So in the event summary, Sala and I broke down what it is when we talk about licensed and trained professional, because there are different types of therapy licenses. So, for example, Sala said she was a licensed mental health counselor, so that's LMHC, where I'm a licensed marriage and family therapist, which is an LMFT. So in the summary, we break those things down. I think the other part is that when we talk about being licensed, we're not licensed by a company. We're licensed actually by the state, by a governing body. And then you have to, in order to become a licensed therapist, we have to do pass the national exam, which is not easy. We have to do postgraduate hours. You have to have a master's degree. So everybody who's a licensed therapist has a master's degree and up. And then in order to keep your license, you have to do continuing education for, I think it's every 2 years. Every 2 years, I believe. And you have to, and it's not one class, it's like 36 hours worth of classes. So those are the things that we have to do in order to keep the license. But in the therapy summary, we break those things down. If you're in the Facebook Live, we will try to get you their tonight's event summary.
Yes. And like Scarlett said, licensed by the Department of Health.
Can I ask you something also? Now, is there a possibility you can email the slides that you have?
Not the slides, but the event summary we provide.
Okay.
Yeah,
just for copyright reasons.
Oh, I see.
Yeah, the event summary has all of this in there.
Oh, okay.
Yes.
Yeah, it's in the Zoom chat.
Okay.
Yeah.
Thank you.
Yeah, and sometimes too, like just some of the reasons why we provide the event summary. It's just you're still getting the information. It's just with providing the slides, sometimes we've had people that try to teach our class, which is something that we have to be mindful of as with Scarlett and I, because sometimes like we make it super simple to where people are wanting to just go ahead and teach that to people, but it can honestly cause more harm if they're not careful. So which is why we just provide the event summary.
Yeah. Okay, but sorry that I came in late. So Scarlett, so you're a therapist. Are you a counselor that we can contact you?
Both Sala and I are.
Oh, okay. Cool.
Yeah.
Cool.
Yes. Thank you. Yeah. Any comments or questions in the chat or anything, Scarlett, before I move on? Okay.
Just clarification. I just threw the link to the cheat sheet on the Facebook.
Okay. Yes. All right. So that cheat sheet is pretty much like has a summary, like little notes. We always like to kind of provide some things for people so that way when you're done with class tonight or you can just, it's something you can look at and continue to look at and take notes and also hopefully help you retain the information even more. Okay. All right. So, what are the benefits of going to therapy? Well, there's I think Scarlett and I can both share our own personal stories and journeys of going to therapy. If anything you'll know about Scarlett and I is we are very, very transparent in our own experiences, because it's the only way that we know how to relate and connect with our community is by the telling of our own stories. You know, so, and I know in my own journey, therapy, of course, this is something that wasn't available to me in my growing up in Samoa. And then through most of my adult life. And it wasn't until later on, until I found out that I can myself get into therapy. And so it was just a space where I felt like everything that I was holding on to, like I just had this space that I was able to just have this cathartic moment with this other person that can be very, very maybe remaining objective and not judge me for what I was saying, not judge me for my thoughts, not even, say anything. But it's more of like, I just felt safe in that space to where I could just share so much with this person, maybe even things that I would normally maybe not even want to share with my husband or something, because maybe I don't want him to look at me in a certain way because of how I'm thinking about things. That's an example, right? So there's so many different benefits of going to therapy. Some that are listed is it can help people in their interpersonal relationship. That means it's your relationship between you and another person. It can help navigate those things, whatever those conflicts might be. It can also increase your own individual individual sense of self, and then also be able to reduce your own discomfort, whatever those discomforts might be. And it could be discomforts around an issue that you're going through. It could be maybe a traumatic event that you've experienced recently or something. Maybe it's even like grief or loss of a family member. Therapy is a space where you're able to reduce some of that discomfort, or even like be able to express some of that. If you're someone that like would just like to keep it in and just kind of have this strong, got to keep it strong for the rest of the family. A therapy is a space where you can just kind of let go of some of that pressure that you're putting on for yourself. Okay. Anything you want to add, Scarlett?
Yeah, I think the biggest thing why I enjoy my therapist and going to therapy is really that reducing the inner conflict. Because like Sala was saying, like when you can just have a space to where you literally can just dump everything and just be like, and then they help you find a solution that, just like Sala was saying, that perspective you just don't see. And even because it's a different conversation versus talking to a friend and they'll be like, of course they're going to be on your side. So kind of need that perspective to where it's like, how can we navigate whatever that inner conflict that you're having differently versus, because I'll say for me, whatever I was doing was not working.
Yeah. Any questions or just comments or even sharing your own experience of going to therapy if you're comfortable? Another thing about going to therapy is when it talks about it aids in decision making. I think sometimes a lot of when people come in, like they could be maybe in conflict about something, or they just can't seem to, maybe they're feeling stuck and they can't seem to move forward on what it is that they want to do. Or can't decide which way or which thing that they should do or person to go with or whatnot. And they just kind of need somebody to be able to just talk about whatever it is that they're going through in their minds. Because a lot of the times, all of those thoughts are already there in their minds, and sometimes it can be overwhelming for them. Sometimes when they just sit there and they think about maybe a decision that they're trying to make and they think about it over and over and over again, it can feel very like they can't move forward, like they're paralyzed or something. So oftentimes I would get people that come into therapy and they just kind of want to like dump it, and then like, okay, once they hear themselves, you know, say everything that was on their mind, it's almost like as they're hearing themselves, they can now know what it is that they want to do just from them talking it out. But they've been holding on to it for so long, and it just keeps going around and around and around in their thoughts, and it doesn't come out. But the moment they start telling me about it, and they hear themselves saying, they're like, oh, I know what I'm going to do, you know? And sometimes it's often that like they don't have that person, that safe person in their lives to be able to just kind of talk things out with. And a therapist is there to be able to hold all of that for them. And at the same time, if they've built that relationship and that connection, a therapist can be able to challenge some of the ways that you're thinking about things. And we'll talk more about that later as well. Any questions or comments? Okay, moving on.
Sarah, can I ask you something real quick here? Now,
yep, sir.
What's the difference between a therapist and a counselor? You know, thinking here is just like, is it a counselor is a therapist? A therapist is a counselor?
Yes, no, thank you, Tony. So yes, so as I think like that's what I sort of mentioned in the beginning. Sometimes those words are used interchangeably by people in the field. Sometimes they'll refer to a therapist as a counselor. Sometimes they'll refer to a counselor as a therapist. The only thing that I think I see the difference is if you're referring to someone that is working in like the school, in a school, and like an academic counselor. You know how like your kids have like a counselor, right? So they are not mental health counselor. They have, you know, maybe like their master's degree in education or something. But their focus is more so academic, I believe, and whatever that looks like in the education realm. But they are not licensed. They would not be called licensed mental health counselors. But you're right, it can be confusing because sometimes you're like, oh, I hear people say counselor, therapist, you know, are they the same thing? Yes, sometimes they are used interchangeably by people in our field. Does that help kind of clarify that up a little bit, Tony?
Yeah, and I think that's where when you start talking about culture and where we come from, you know, because we were so family oriented back there in the islands, which is, you know, it happens here also.
Yeah.
But live in a big country like America, yes, it's crowded, it's big, yet we're isolated.
Yeah.
You know, and we don't have that close network, close knit that we used to have in the islands.
Yeah.
You know, now, here we live here, and we're kind of, you know, yes, we live together, but still we're very isolated in a huge country like America, and I think it's great what you guys offer.
Yeah, absolutely. Thanks, Tony. No, I think we try to be, you know, as much and as often as we can to connect as communities. But like you said, it still doesn't feel the same. You know, it doesn't feel like it's that immediate connection. Versus like when you're back home, it's just different. It's such a different feel. So I absolutely understand what you're talking about. But here in the U.S., no matter how much we try, you know, there still is that a little bit of a disconnect. You know, and we'll only meet up and connect when it's like, you know, cultural gatherings or things like that. But I think the sense of it still isn't the same as back home.
Yes, but also I have a first cousin who is a psychiatrist in Tacoma. And there is an increase in this mental health there.
Wow.
I mean, last 10, 15 years, there is an increase there. I mean, and it's very, it's heartening, but it's a reality.
Of course. Yeah.
Of course, the United States is the same way. Yeah.
Yeah. I think I would say that's because I think the information is getting out there and people are becoming more aware of the information, and it's like, oh, maybe that's what's been going on with me.
Right. Yes.
You know, so finding the language, finding the words.
Yeah. And I think when we shared and said, hey, you may have diabetics, you may have headache, or you have high blood pressure.
Yeah.
Same thing with our mental. We sometimes have some issue with our mental. Part of our body, and it's part of our lives.
Yeah. Tony, were you here when we played the video?
Yes, I did.
Okay. Yes. So just like what you were talking about, you know, where it's sometimes it's like, you know, that's what people our communities are kind of seeing mental health with. But yeah, like Scarlett said, like I think we've all experienced it to some degree, but I think just now with the spread of information and everything, like everybody's becoming more aware of what it is that they have. So now that they know what it is, now they're starting to try and get the help that they need, for sure. Yeah.
So I'm going to share something in the chat. It says, somebody shared, I need therapy. My daughter and I, we just lost my son. I really need help being treated for my feelings. And thank you for sharing that. We appreciate it. And so I sent you a message, reach out to us so we can share some resources with you. So, but thank you for sharing that. I appreciate that.
Yes. Yes. All right. So we are coming into building trust in therapy. So in therapy, one of the main things that therapists are trained to be able to try and establish from the beginning with their client is this thing called a therapeutic alliance. And the therapeutic alliance is this relationship between the therapist and the client that is sort of centered and built and founded upon rapport and trust. And if you think about it, just like with any other relationship, there has to be trust there, you know, in order for people to be able to just open up and share some of maybe the most difficult things that they're going through. In any relationship, trust is really, really important in the relationship in order for people to be able to open up. So therapists are trained to be able to really, really hone in and consider the importance of that relationship between the therapist and the client. And we call it the therapeutic alliance, which is all it is it is the trust between the therapist and the client. And it is built on rapport. So if you go to, if you've been into therapy before and, you know, you go in there and it seems like your therapist is trying to make small talk with you, it's because they're just trying to get to know you. It's because they're trying to make you feel comfortable. It's because they want to know a little bit more about you. And it can be the same thing where you can also do the same thing as well. Ask your therapist questions, which we will touch on later on. But you can ask your therapist questions as well. Get to know them as well. Because then if you're not comfortable speaking to this person, you're not going to open up and share why you're actually there in therapy. Scarlett and I sit across from people that are just going through, for some people, like the worst days of their lives. And so, you know, if we just come in there and, you know, we don't have a rapport with them and we just say, okay, what are you here for? You know, if I'm going through things and I'm going to therapy, I'm not going to sit there and try to, you know, open up my feelings to someone that's going to speak to me that way. You know, so therapists are in building this trust in therapy. We're taught to be able to, like, how do we take our time to nurture this relationship between you and the client? Okay. Any questions or comments just about what this is, or if anybody ever want to share their experiences as well?
There's actually a question in the chat box, but I just want to read it from Louisiana. Often, do you deal with teens?
Is that a specific question? Do Sala and I work with teens, or just therapy in general?
I'm assuming it's to both of you two.
Yeah.
Yes.
We work with teens. Mm-hmm. Mm-hmm. Yes. Was it Louisa? Is that what she said?
Yeah.
Yeah.
Yeah, Louisiana Coffin.
Louisiana. Yeah, we do. Just to add on to the building trust in therapy, it's that is a key component in order for therapy to be successful. Sal and I are big advocates for therapist shop. Mm-hmm. You don't have to stay with one person. You know, even if you saw a therapist, I'll give my example. I had a therapist for 2 or 3 years, and I just needed to help her with one thing, and then took a break from therapy, and then I had to find another therapist that suited me for where I'm at now. Not anything, she didn't do anything bad. It's just it's like, okay, that was that part of my life. Now I need somebody to address this part of my life who had the specific training I was looking for. So like I say, therapist shop, you have to go for what your needs are. And so we were big on putting your needs first and not the therapist needs first. Mm-hmm.
Yes, and you will hear us talk about that therapist shop all the time. In my experience, when I see new clients, I'm always letting them know, because sometimes clients will come in super nervous. So just to put them at ease, I'm like, just think of it as like I'm the one getting interviewed for a job. I'm the one that's, I have to make sure that you're super comfortable talking to me, so I want you to hire me, so just to put them at ease in the beginning. But then I always let them know that even if after meeting with me for that consultation session and you feel like, man, I don't know, man, Sala just be talking way too much for me. I don't think I'm gonna get a word in with Sala. She just be talking. It's okay. That just means like, okay, you just want you want someone that's different, maybe someone that's just gonna listen to you more. But it just depends on what it is that you want. And if you go in and you meet this therapist, it does not necessarily mean that you have to stay with this therapist. Just because this is who your insurance assigned you to, or this is the first one that you found and this is the first one that got you. Like, no, find a different therapist that you feel like, you're able to feel more comfortable with. And then later on, we're going to go into just a lot more specific ways that you can do that. Okay. All right. So the different types of, Celie, did you have some?
Oh yeah, just a follow-up question from Louisiana in the chat. She can get more information and connect with you guys, right? So we can put that on the chat. Okay, cool. Just want to make sure. Thanks.
Yeah. Thank you. So if you are not aware, there are different types of therapy. So there are individual therapy, which means it's just one person and one therapist. There's group therapy. There's group therapy, which could be several people at the same time. And then, you have the therapist as like sort of the facilitator. And sometimes these group therapy can be based on a certain topic, or it could be specific. It could be an open group where anybody can come in, or it can be a group where it's closed off. Where it's just whoever signs up, like that's who's going to be in that group. And maybe they're all working on maybe addiction or something like that. There's also family therapy. So if you did not know, what I get a lot from family therapy is usually parents and kids, right? Because it's usually parents and kids. And I think in my experience is just, I'll have like, maybe parents that are just so overwhelmed and not really knowing how to connect or communicate with their kids and what their kids are going through. And sometimes that family unit just needs a little bit of assistance to be able to navigate like that conversation. Or how do I, work through this? Like my teen is going through this. Like, how do we come together as parents, as a family, to be able to work this out? Because we know that it's not just the teen that's messing up. What's going on in a family unit? So then you have a therapist that can navigate those conversations between the parents and the kids, or the parents and the members of the family. And then you also have couples therapy, which is, of course, that's a couple, people that are in relationships, committed or not, and they are in, maybe they're wanting to address an issue in therapy. It could be issues of infidelity. It could be issues of divorce. It could be issues like whatever it is that they're going through. Remember, think about that ball of yarn that's all knotted up. All of these different types of therapeutic groups, like they all have that sort of ball of yarn that's just all knotted up, and they're still going to see a therapist just to be able to kind of unravel some of that yarn just a little bit. But the only difference is it could be individual, could be a group, could be a family unit, and couples as well. So if you didn't know that these are the different types of therapy that you can participate in, or you can, kind of ask your therapist about as well. Scarlett, did you need to add anything?
Yeah, just for the types of therapy is when you're looking for a therapist as well, is to, I think you mentioned it a little bit, Sala, like there is therapists who have specified training, like if you want somebody who just deals with a certain, like depression or anxiety or family issues, family of origin issues, parenting, there are therapists who actually have specified specializations in those things. You just have to think about what you need in the therapy space. Yeah. That's the only thing I wanted to add.
Yeah, that's such a good reminder. And then also with all of that, like it comes the different, so I think what Scarlett's talking about is like sometimes it could also be the credentialing of the therapist, right? So if, for example, you have your maybe going through or went through a traumatic event, there are therapists that have specifically not only have went through the rigorous training that Scarlett talked about, schooling wise, hours and testing and all of that. Not only did they go through that, but after school and after getting all their hours, they are specializing in just working with trauma. They are it could be even population. So someone that was asking about, working with teens, we're all kind of trained generally in all of those different areas, in all of those different populations, to work with all those different kinds of people. However, there are therapists that have decided to, you know what, I just prefer to work with teenagers. So that's all the people I see in therapy is I'm just going to work with teenagers. I don't see adults. I don't see little kids. I just see teenagers. And hey, that's their sweet spot. And they found a population that they work very well with and they've niched with. And so they stuck with it. So if that's something that you are looking for in a therapist as well, then you can look specifically for those credentials as well. Okay. Right. We will keep it moving. Psychotherapy and culture. So psychotherapy, this is usually the part where, I kind of try and tie in my culture. I'm Samoan. So I tie in my culture to, if I were to speak to, we've done this a lot of times where we've spoken to our Samoan community about therapy. We every time Scarlett and I speak to our Samoan community, specifically Samoans, about therapy, we make it very, very relatable to our culture. So we would pull in all of these, different aspects of our culture. Like in the Samoan culture, there's a thing called the va. And in English, it's that relational space. So as I'm thinking, if I were to talk to my Samoan community about therapy, I can use that concept of that relational space to talk to them about and let them know, like, this is what therapy is. It's that between you and another person, So you see what I'm doing, where I'm trying to help my community understand a little bit about what exactly is this therapeutic space, this Western concept of therapy. So I would liken psychotherapy to that relational space in the Samoan culture that's called Wa'awheloloi, which is a proposed space in which people can respectfully talk and negotiate things. It also, in the Samoan culture, this Wa'awheloloi, it really signifies so much honor into that simple space. And it's very sacred. It's a sacred space in the Samoan community. So I would use that to just try and be able to help my community understand what this concept, this Western concept of therapy is for them, and how it can be helpful for them in getting the help that they need. Because truthfully, it is not something that is that we usually use in our communities. It's not. So we have found that, like, if we are able to just tie in our culture and help our people understand from our cultural perspective, the more open our communities would be about this new avenue of help. And then another thing we always try to bring in is we let our communities know, like, you know, we are just introducing this new concept of help. It's a different one, just another one that you can add. But we're not taking away from our culture. And we know that, like, our culture is a huge part of who we are. So we never come in and say, you know, no, this is a better way of doing things. No, we always say, no, we appreciate, we value, we honor our culture. We just want to introduce just another avenue of help for our communities. Scarlett, did you want to add anything to this one?
Yeah. I think one of the things I want to say about in regards to this is that it is not your job to teach your therapist about your culture. Mm-hmm. It's there because they are to do that work for themselves, because again, that space is not for you to educate them. If you want to, that's fine, but it's their duty to do the work to figure out what culture is, because again, that space is for you. And you know, as one of the questions that you know, or things you can seek out is somebody who is culturally sensitive, who is and who can actually understand, you know, whatever cultural background you're from.
Mm-hmm. For sure. All right, so how to find a mental health therapist. How do we do that? This is one of the questions that we get a lot. And sometimes people would just book appointments with us just to be able to ask us some of these questions. So this is why we want to include that in our community conversation. So how do you find a mental health therapist? So these are just some of the different ways that you can find a mental health therapist. And I say, connect with your healthcare provider for a referral, because most of the time our communities, we are more likely to go see our medical doctor than anyone else. Like, we go to our medical doctor for everything, you know. So if that is your first go-to, that's absolutely fine. You can, you know, as you're over there getting your medical annual appointments taken care of, and you feel like you've been going through some things and just need to speak to a mental health therapist, you can let your provider know, like, hey, can I get a referral to a mental health therapist? And your provider will provide you with that referral, just like they do when you need a referral for chiropractic care, just like they do if you need a referral for, you know, something with your ankle or whatever, you know, whatever it is that you need taken care of, they will provide you with that referral. It's the same thing when it comes to mental health. And I think right now too, in like the doctor's office, they give you these forms now where it's more of like a screening form. They're screening for anxiety and depression. And so depending on you know, your responses to those questionnaires, it'll also let them know, like, hey, maybe you need to ask this client or this patient if they would want to see a mental health provider. And then they'll ask you. Okay, so that's one way. Another way is, of course, like a lot of people, you utilize their insurance company and for in-work mental health providers and referrals. So that's another way you can find a therapist, is connecting with, you can call up your insurance company and say, hey, this is where I live. Can you send me some referrals of mental health therapists that are close to me that take my insurance? So that's another way that you can get connected with that. We also say, like, if you know someone and you trust them, make sure you trust them. If you know someone and you trust them, and you know that they've been to a mental health therapist and they always talk about how amazing their mental health therapist is, maybe that's someone that you can ask, like, hey, can you connect me with your therapist? Or if not, like, do you know if your therapist might know someone else that's accepting clients right now? Maybe they can give me a referral or something like that. So you can ask a trusted friend or a family member if you are comfortable. Another way that we see a lot of people come through from our communities in therapy is the EAP. What is it? The employee assistant plan, I believe is what it's called. And so they usually, this is, I think, connected to their workplaces. I think some workplaces offer what's called EAP. And what it is I believe it's like funding that's just allocated for that employee to be able to seek mental health services. So you can see a therapist utilizing that as well. Okay. And then also we say contacting local organizations. We always say the local organizations that Scarlett and I always do work with is APCC, and then also with King County. But I also think about like our Shoreline Community College organization, their WAVES group, and how they can also be a hub of resource, because then I think if you connect with them or if you know them better, and you're like, hey, that class that those two therapists were talking about mental health, how can I get connected with them? Can I get their information? So reaching out to those local community mental health organizations, or just community organizations for information about mental health. Make sure it's trusted ones. The two websites that we have listed here are really, really good resources. For example, the multiculturalcounselors.org is based here in Washington, and that directory is all therapists of color. So you can go on that website, and if you can filter the therapist by ethnicity. You can filter the therapist by their maybe religion, by language. You can filter the therapist in that way. Like if you speak Mandarin or something, then you can go on that website, multiculturalcounselors.org, and you can click on the language that you prefer your therapist, and then it'll provide you a list of therapists that are that are licensed in Washington, that maybe speak that language and can do therapy in that language. So the multiculturalcounselors.org and the Psychology Today, those are mental health therapist directories that you're able to kind of go in there and filter through for finding a mental health therapist. And then once you're able to pull up their information, it has all of their websites. It has their contact information, their phone number, how to reach them, a little blurb about them. And then you can just reach out and see about scheduling a session with that therapist. Now, if you go on the multiculturalcounselors.org and you filter in Samoan or Pacific Islander, I think you'll just see that it's just Scarlett and I up there. But we're getting some more. We're getting some more up there. But Scarlett, did you want to add anything to this one?
The only thing I wanted to add, just for like a local resource, is that whatever county you live in, you can go to the county website and they will have mental health resources on there as well for whatever county you live in. They should. I'll just say, I know for King County, counties in King County, Pierce County, and I think Thurston County does a really good job listing out the resources, and even giving part of the resource. Last time I saw, they even give community mental health programs that you can possibly join as well.
So, for everyone that's out there and you're like, how do I find a therapist? These are just some of the ways these are really the main ways that you can just get connected with a therapist like ASAP if you need it. Okay. All right.
Let me add one thing, Stella, too. Last thing is that even if you are not living in the state of Washington, like Stella and I are connected with quite a bit of people. So even if you live in another state, we will help you hopefully help you in any capacity that we can to help you find another therapist in another state that what you're seeking.
Mm-hmm. Yes. We are connected with an amazing network of Pacific Islander therapists throughout the U.S. There's not a lot of us, but they're kind of spread out throughout the U.S. So just let us know, and we will try our best to kind of find you any resources or referral if needed. All right, so let's say now you know how to find a therapist, and you are now sitting across from your therapist for your first appointment. Now this is where you get to ask your therapist some questions. So some of the questions that you can ask this therapist is, how long have you been practicing? How much do you charge? What are your sliding scales? Like, even if they listed these things on their website, you can still ask them about it. You can still ask them about it just to confirm, like, okay, on your website, this is what it says, but, I was wondering, do you have a sliding scale? A sliding scale, if you don't know what that is, a sliding scale is sometimes therapists will have their full fees or their full rates that's there, but at the same time, they will also have like a sliding scale where it says reduced rate for just, it's more of like a first come, first serve basis, and they can only take a certain number. Okay, so sometimes you can contact that therapist and maybe they're full with their sliding scale clients, so they won't accept any sliding scale clients. But you still just call around until you find a therapist that still have room on their sliding scale to be able to accept you. So not all therapists offer sliding scales. Some therapists do. So just be on the lookout for that, because not all therapists offer sliding scale. You can also ask your therapist, well, how long are the sessions? Like, even if you're going in there for something specific as well, like maybe you just experienced, a loss of a loved one, and you want to just kind of, go in for some grief counseling. So you can ask this therapist, how can you help me with, losing my husband? How can you help me with this grief that I'm feeling about losing my sister? How can you, it's almost like, I want to know as a client, how can you possibly help me? Can you tell me that? And that therapist, they know exactly, because they know exactly, what they can do as far as working with you through grief, through trauma, through whatever it is, different experiences. They know exactly how to, but it's just that a lot of the therapists, they all have different approaches to treating a certain thing, like trauma, for example. Okay, so you can always kind of ask them, like, well, how can you help me with this? And if you're like, okay, you know what, the therapist that I saw before also did that and it didn't work, so is there something else that you can do? You can let them know that. Okay, so of course, like we say, you can ask your therapist questions, because what we have noticed is a lot of the time our community members, we're just kind of going with the flow. Like we get, like an insurance company says you have an appointment, you can go see this person, and then you show up and then you're just there and you're like, okay, I'm here. Like, now I can't do anything about it. Like, no, you can do something about it. You can ask this person question. And sometimes either that's cultural or not, whether we're comfortable asking questions or not, but you can ask them questions and they would be more than happy to address those questions for you. Okay. Scarlett?
So, can I ask you something here?
Yeah. Yes.
Now, the therapist, they have different focus or different specialty, like let's say somebody comes in with a bipolar, or the other guy comes in with depression. Are you guys are specializing in an area, and you see what I mean?
Yes. So yes, there are mood disorders, right? So yes. So like I said before, like the therapists, we're all generally trained in all of these things, all of our schoolings, backgrounds. We are trained in treatment and diagnoses and being able to assess for all of those mental health disorders. I think what you're maybe getting to is there are therapists that, in addition to that training, that general training, they can specialize in just working only with let's say, for example, bipolar. They can just say, you know what, I really enjoy working with people with bipolar, so that's all I want to work with in therapy. And that's what therapists do. Like, either you found like a sweet spot you want to work with, and you can just focus on that.
Okay.
So yes, you can. A therapist can be specialized in just like one thing.
So should be part of the questions that you ask a therapist?
Yeah. Yes.
What area are you really, are you good at? It's your niche.
Yes. Yeah. Absolutely. For sure. Yes, you can ask them that. Like, or even like, so I see on your website that you worked with depression and grief and this. But I'm just wondering, do you have any experience in working with bipolar disorder? And if you do have experience, like, what's your approach in treating bipolar disorder? So yes, you can absolutely ask them that. And so, like I said, maybe this therapist is specializing in grief or depression or something. And then they'll just tell you, well, you know what? I am specialized in grief, but I do have experience in working with clients with bipolar disorder as well.
Okay. So now the therapy will have to go hand in hand with meds, right? With medications.
Medication. It can be, yes. It can be. It can be because the psychopharmacology part of that, which is the medication, can be dependent on the client. Because sometimes clients would be like, I don't want to do medication. I just want to do therapy. Sometimes we would even recommend, like, hey, this treatment is more effective with therapy and psychopharmacology stuff. But the clients would be like, I don't want to do the medication. I just want to do therapy. And we can't force them to. But yes, so some treatments, of course, like that's the recommendation. Like, would highly, highly recommend both.
Yeah. Do you guys prescribe meds?
No. Okay. Licensed mental health therapists do not prescribe medication. They can diagnose. So we have diagnose, powers or whatever, but we do not prescribe.
But do you make recommendations or?
Yes. We make recommendations to psychiatrists, but we don't make recommendations of medications.
I see.
Okay.
See.
But to add on to that, but we're aware, like our clients will inform us of what medications that they do take, so we can monitor how that is impacting them throughout the therapy, because sometimes we work closely with whoever the prescribing doctor is, so we can inform them of the symptoms that we're seeing. But that's if the client signs a release of information form.
Mm-hmm.
And I think that is very, very critical, because in a lot of our communities, they do not, because it's something, of course, it's like a taboo thing, to talk about.
Yeah.
It's kind of, but when it happens to the family, member of the family, they don't know where to go. Mm-hmm. Or when they go to places where they're not, they just tell it, okay, go to the ER, and they'll take care of it. And you go to the ER and sit there for like 8 hours and come out with not very much.
Mm-hmm.
Yeah. I think it's important to, I'll say in regards to prescribing those who prescribe medication, what I in particular always recommend for my clients is those who to go to a psych MD for prescription, not their primary care doctor, because it's a different training that they have.
See, and that's where the breakdown is.
Mm-hmm.
When you recommend to go to a psych
MD, a psych MD. Yeah, their schooling and specific training is medication for the body.
I know, but where are they? Are they in the hospital? Where do you find them?
You can find them through your insurance.
Yes.
Oh, you can. Yeah, through your insurance.
Yes.
Yeah. Okay. Yeah, because even a psych MD nurse is the same.
Okay. Okay.
Yeah, and some of these things can be so like confusing, right? Because like everybody only sees the medical doctor, you know, like their provider. But psychiatrists are actually the ones that's like, they are the one that they're specialized. All of their training is all on medication. So that's the one you want. That is the one that you want to be able to be prescribing, because that's all their focus is a psychiatrist.
And that is where the breakdown is, because our community, a lot of people don't have access to a psychiatrist. You try calling the list of psychiatrists in the state. Yeah. They're either busy or they don't have room for client. They don't, especially you try to explain. Okay, they ask you, what is it? What is the diagnosis? He talked to himself, or he talked loudly, or
yeah.
You know what I mean? There's the breakdown right there. You always go to the AR or your primary doctor.
Yeah.
If you don't know a psychiatrist, or
right. Yeah, or even who to look for, like you said, a psychiatrist, because everybody just knows to go look for that medical doctor.
And the people like you guys, know how to direct them.
Yes.
This is where you're going. Okay. Look for a psychiatrist. Find, you can't just, but anyway, I mean, I think that the information you're giving out is really great.
Good.
You're welcome. Again, that's why we enjoy doing this series, because again, it's just empowering our community with this information, because you don't get it unless you actually see a therapist. And so that's why we're like, we have to do this for our community.
Yeah. And connect it. Cap there, because if you grew up in the islands, when you get sick, you go to the hospital.
Right.
Here, there's different hospitals, there's different doctors, there's different,
Yeah, there's different doctors, different specialties. Absolutely, yeah. So when you are, you're there, we shared with you like how to look for a therapist, questions to ask a therapist. Another way to, some of the things that we would want you to be able to look for in a therapist is how long have they been, did they complete the rigorous training that Scarlett and I were talking about? Are they licensed? Are they even licensed? Because like a lot of the times too, sometimes people just be saying stuff on social media, and I'd be wondering like, are you actually licensed to be able to speak on those things? So it's very important, the credentials, because sometimes there's going to be a lot of misinformation if we don't understand where that information is coming from. So make sure that therapist is licensed and have met all the licensing requirements by that state. If you're looking for a certain therapist that is specialized in a certain area, or a certain mental health disorder, like just specifically looking for one that's treating trauma, specifically looking for one that's specializing in working with bipolar, like it'll say that in their website. It'll say that in the little blurb about themselves. And then also like making a lot of people use their insurance. So make sure that therapist is accepting your insurance, and make sure that, you let them know like, hey, another question you can ask them is like, hey, like, do you accept my insurance? Are you considered in network or out of network? Asking this, making sure that the therapist, like if you're paying out of pocket, making sure that their fees meet your budget, and if it's within your budget of whatever it is that you want to pay for therapy. Okay.
Hey, Sal, I have two questions.
Oh, yes.
One was kind of related to the other slide. Had a nephew hit me up, but if you're younger and you need these resources, you still have to go through your parents, right? I mean, that's kind of the idea there.
Yes.
When
what age, Silly?
I'm just assuming 16 to 22. I'm assuming that under 18-year-olds. I mean, it's relative to do you work with the teens questions of, how do you bypass your parents of saying, I need help? But they're like, you're fine. You don't need help. It's all in your head. So that's the first question.
Okay. So no, if they are over the age of 13 and up, they don't need the parents' permission, because according to Washington state laws, this person is considered an adult and can make their own mental health decisions. So don't really need the consent of the parents if the kid is 13 and up. Now, if they're below that age, then they're going to need the parents' consent.
Oh, actually, that's super helpful. I didn't think. Okay.
So just to clarify, it's for mental health.
Yes, for mental health.
And if they are breakdown with their mental, how can you make a wise decision if you are 13 when you are having a mental breakdown?
Yes, yep. Yes.
It's like going to a garage, to a shop, and there's a sign there. Hey, if you are a head breakdown, honk. That's why I'm here. That's what it breaks. It's honk.
Yeah.
It's right here.
And that's why I think like the hope is that even if this maybe, say for example, 13-year-old does not have that or have like a poor insight into their own mental health and is not seeking the help that they obviously might need, I think the hope is that the intervention or the families or the friends or whoever can intervene and be able to talk with that client, with that person, and say, hey, we can see how your mental health is impacting your life, and we want you to get help. So that's what they can do as far as intervening in that way, the friends, the family, and things like that. But that person still had to initiate service. Like they still had to initiate the service.
Yeah, that is correct. And also when you flip it around and somebody goes in, they cannot really make good decisions for themselves. Adults, I'm talking about adults now. Parents has to have a permission to get involved and interact, and interrupt or interfere. Is that which is an issue that we're dealing with, is the legal thing with HIPAA.
Oh, sorry.
All that.
What was your question, Tony?
Well, no, what I'm saying is that when somebody goes in, a member of the family goes in with some challenges with mental health, and when the parents is wanted to help and interact with the therapists or the doctors, they're so protective of that it's very difficult to go in as a parent to help. You see what I mean? They don't even give out any information to the parents. And see, that's another culture.
Oh, yeah.
Coming from the islands,
Right, right.
That we are so close to each other, and hey, it's a kid. Doesn't matter whether he's 4 or 14 or 40, he's still my kid,
Yes.
When you go into the hospital and interact with them, they say, no,
right.
You're not, if they don't, you see.
I know what you're talking about. You're talking about Tony, or what you're alluding to. It is because in our communities, it's families extends to maybe even for some, like just other than your parents and your siblings, you'd be extended family. But sometimes when we go in and we see our kids, we're being told like, no, it's against the law or whatnot. So it's really them not being considerate of our cultural values of community and of family, and so that's the disconnect that you're talking about, and how, and I mean, that makes sense because the law just says, no, this kid can make their own, decision. The parent can't be involved. But we're coming from a more cultural context of, but in the Samoan culture, you could be 25 years old and you're still a kid. You still got to go perform on the Children's Sunday and march up there and do all the dance. You're still living at home. It's just a different cultural context that unfortunately maybe some of these laws are not taking into consideration. But that's an issue for another day.
Okay.
No, and I get it. And you're always still asking for permission too. I've got some older nephews. I'm like, dude, aren't you like over 21? Like, at some point in life, you got to be an adult. My last question was to was the payment structure, right? Because a lot of folks are just like, bro, we out here buying shoes per session. Like, but how do you justify that, right? What is like a way that you?
Oof.
I don't know.
Scarlett, answer this one.
get people. Well, how do you get people comfortable in the uncomfort, right? Like, if I'm not used to paying $200 to look inward and work on myself, like, how the hell do I justify that? It's like, bro, that is a light bill, that is groceries. I'll stop there.
You know, it's a good question. I think when we talk about, you have to look at the value of what therapy brings, because what we're talking about is truly life skills that we're imparting on a client. Because the life skills that we teach, you don't just keep it to yourself. You actually pass it on, and it goes on. And we're talking about literally making generational changes by the information that we share. And so, because a lot of times we spend stuff on to avoid an issue, where of course therapy is talking about, like, we're talking about, we have to confront those things that we hide and don't want to talk about in order to do differently. And it really is, do you want a different outcome in life? So that's the value that we're talking about when it comes to therapy. Does that help, Celie?
Yeah, no, it's not a cultural norm for us, right, to go out there and again work on ourselves, like working out, making sure you're providing for your family financially, but it's a different concept. So a lot of this is actually helpful too. So
and you know, like I said, we're introducing something that's again not typically familiar with just the AA and HPI community. And so that's why we have to delicately call out these things so that we can make a international wide impact, so that we can do different for our community. Because, like Sala said a little bit earlier, AA and HPI heavily underutilizes therapy. I don't even think there's Pacific Island stats. That's how much underutilized it is.
Well, it might be clustered together with Asian, right? Asian Pacific Islander, as opposed to just NHPI.
I think that the study where I got that from was separated, where it was specifically the Native Hawaiian Pacific Islander communities. So, but just to add on a little bit of what you said, Celie, I know we're pressed for time, but honestly, like when I have my family members that are saying like, oh man, I can't afford therapy. You know, usually because they're my family member, I'll just be like, can you afford not to? You know, like you're already going through so much and in all of these things. And, you know, I'm a firm believer of like, what you value is what you will, you know, that's where your money is going to go. You know, so it's up to you. And this is me talking to my family members, like, it's up to you. Like, we can go through your statements and I see you valuing Starbucks like all day, every day. So, you know, it's like, it depends on, and I think like, this is why we keep doing this, because like, I think most of our communities don't see the value yet. I think maybe we're starting to see the value in therapy. We're starting to see the value in addressing some of these things, but we're far from it. We're far from the point of like, you know, like, oh yes, yeah, sure. Like this is, I can't afford not to put my kid into therapy or put myself into therapy, you know? But okay, we're moving on. Lastly, I think this is my last point, was understanding that as a mental health consumer, that you do have rights, just like you have rights in everything. You have your individual rights to be treated without regard to your race, your gender, your religion, your sexual orientation, your age, your disability. You have the right to be treated with respect. You have the right to kind of request your records or notes or things like, not notes, but just your records from your therapist. Just know that you have rights as well, even in that space. Okay, because I think a lot of times our community members don't know that's like, oh, this therapist can do whatever they want to do. It's like, no, they cannot do whatever they want to do. You have rights. So if you go into that space and you are treated with, you know, disrespect, or you are treated with just against anything that you believe in, there's a way that you're able to hold that therapist accountable. Okay. And then also HIPAA. It is, again, one of your rights to be able to get a copy of your information. And we always say this because sometimes in our communities, our communities are so small, and, we tend to see each other everywhere. And so sometimes I'll even tell my Pacific Islander clients, like, if you see me at one of the cultural events, or if you see me at church or something, like, just know that I am, not out here telling everybody your information. Just know that you have rights. Just like you would any rights with your medical doctor, like I also am liable to all of those things, and we are legally able to kind of make sure that we don't break any of those confidentiality things with your information. So just know that this also applies to mental health when you go see a therapist. Okay.
So Sarah, if somebody wants, let's say your parents wants to know about your stuff, okay,
yes,
your record, do they have to get a power of attorney? What type of paperwork, or they just need a permission by your children or whatever to sign off so they can release whether the therapy or the psychiatrist or doctor release information?
Yeah, so if the parent is trying to get information from the therapist, right? So it depends on whether or not this child is under the age of 13 or not, right? So if the child is under the age of 13, the parent is going to get all that information.
Yeah.
So all they can do is they can ask the therapist, hey, can I get a copy of, of your records and it'll be the diagnosis, whatever it is that, that therapist diagnosed your child with. It'll be not the notes, right, Scarlett?
No, it's, so what you're talking about in regards to the form, it's called a release of information, and whoever on that form, the client will check off what they want
exactly,
to share
yes,
to the parents.
So that's all you need. You
yes.
Okay.
Yeah.
Yes. And you can definitely you get that information from that therapist.
Mm-hmm.
You just request it. You can request that information from that therapist about your kid. Now, if the kid is over the age of 13, unfortunately, you as a parent cannot request that information. The kid has to get that information.
Yeah,
and
the
then
ROI.
Or they have to complete the ROI saying that it's okay for the therapist to give my information to my parents.
Yeah. Okay.
Yeah. So I think that's that sacred space that Sala was talking about earlier. And so it's a protective factor, because we know, like, what we tell our clients is, for example, if your mom or dad or pastor calls me, hey, what did Sala talk about in session with you? By HIPAA, I am legally bound not to say anything. The only thing I can say is what Sala was saying. If they sign that release of information form and then they indicate what I am allowed to share.
Okay.
Yeah, and it's so sacred to the point where people can call in. Like, if they call in my office and they say, I just want to see if Sealy made it to his therapy appointment today. I can't even acknowledge to this person. I can't even acknowledge whether or not Sealy is my client on the phone.
Yeah, even the hospitals.
Mm-hmm.
I mean, the mental health hospitals. If you call to find out if your loved ones is there, they're not going to tell you.
Yeah, yeah. So they would have to. So that would be that would be the release of information, that if your loved one is in the hospital, they would have to sign that release of information and note down who they want to release their information to. So they can say, like, once they get into the hospital, they can say, if so-and-so call, like if Tony calls, you can go ahead and let them know that I'm okay. And, you can let them know about my treatment. and whatever else that you want them to know. But that person has to complete that paperwork that's called the release of information.
Yeah.
Perfect.
Good questions.
Good question, Tony. Hopefully that kind of sheds some light into therapy and kind of getting into therapy, and hopefully empower you tonight, whoever is joining in, into knowing that this is just another avenue of help that our communities can take advantage of. But that's what we got for tonight. Join us for our conversation next week that Scarlett will be facilitating. But I'm going to turn it over to Celie right now, or Scarlett, for any final words.
Just final words is please fill out the survey. This is a comment to Vince. No harvest buffet. Okay. Harvest therapy over harvest buffet, please. But please fill out the survey link. It helps us continue to offer these inner wellness series to our community for free. It helps with the funding portion. Again, we can't thank you all enough for joining us and being such great conversation in each chat. We definitely honor that for sure. And so, again, if you have questions, even after you get home or when you get off of this, if you have more questions, please don't hesitate to reach out to us. We're here to help in any capacity that we can. So thank you again. We appreciate it. Celie, floor is yours.
Yeah, so similar to what Scarlett said, we did put that link on the Facebook chat. So even if you're rewatching this on the Big Goose Radio, we just encourage you just to fill it out. It helps us with funding and continuing to elevate these conversations, right? I mean, this is probably the fourth time I've heard this, because I've been in space with Sal and Scarlett, and I continue to, improve and learn something new. I'm close to getting a counselor. We're almost there. Like, I used to get them, but it was like, bro, this is a lot of money we're paying for somebody to tell a story with. But it's very helpful, actually. It's very productive. I appreciate them. But the conversation continues, right? So I'm excited about the next one. So again, this is kind of a launch kickoff for our Oceania Health Summit as well. So as we are addressing mental health, the youth and young professionals we are working with, we're saying this is one of the big topics that they have within their, sphere of influence. So we just appreciate folks for coming tonight, and also want to thank Shoreline Community College and the WAVES program for, helping us fund this as well. And shout out to DJ Una Heffa and the Big Goose Radio for always making us look good. But with that, everyone have a great night.
Thank you.
Thanks.